we're hot, yeah. Good morning. I'm Jeff Flaks, the President and CEO of Hartford HealthCare. Today, we have several important issues that we look forward to discussing. First, I want to bring forth an important initiative that we're advancing right now, which is our Colleague Support Center. We're launching a 24-hour, 7-day-a-week Colleague Support Center. When we look at what we're addressing today within our health system, amongst the most important issues we need to work through are the issues around how we are able to care for the people who are caring for us, our communities, and our patients. The Colleague Support Center that we're setting up, first we'll have a line that's in place that will allow us to give behavioral health services to anybody who works with us in terms of counseling, support, someone to talk to, people who can provide advice and counsel for whatever issues they're confronting during this crisis. Secondly, we're going to be able to provide housing support services for those who need it, advice and support on daycare services. We're going to have other services that people identify where they have needs. We're going to have dedicated staff within Hartford HealthCare who can help address whatever needs are being presented by the people who work on the front lines. So I'm really pleased. I think this is an essential thing that we've identified during this crisis that we need to do. We're also outfitting and building comfort rooms for our staff across all of Hartford HealthCare so that people have access to healthy snacks, to other support services in rooms where they can go and have opportunities to step back from the front lines and get the support that's necessary. So this is something that's been announced throughout our organization, being stood up stepwise across all of our facilities. The first one is being activated or has been activated at St. Vincent's in Fairfield County, and we now will build these throughout Connecticut. So we're very pleased and very much look forward to that effort. Secondly, I've invited, and I'm going to ask to come forward in a moment, Bimal Patel. Bimal's the president of our Hartford HealthCare Hartford region and of Hartford Hospital. And in addition to those responsibilities, Bimal leads the efforts with executive oversight of our clinical laboratories. And we're going to discuss important advancements that are being put in place now relative to viral testing, antibody testing, how we're able to support people going back to work in a return to work program, and how we're going to harness and use all of the 400 plus access points and the many capabilities we have within Hartford HealthCare, that as we look to pivot and as the state looks to return to work over a period of time, and as we partner with Governor Lamont in the state of Connecticut, that we use our infrastructure and we can channel it to help support these efforts. So we're very excited about a partnership that we've built that's being put together with Quest Laboratories in aligning the resources at Quest Laboratories with the incredible capabilities in Hartford HealthCare to together really advance Connecticut and put us in as good a position as we can be as these innovations come forward. So with that, let me ask, again, President of the Hartford region, Bimal Patel for Hartford HealthCare, and our executive with oversight of our clinical laboratories, to provide more specificity and more clarity on the very specific actions that we're announcing relative to our approach with our clinical laboratories. Bimal, please.
Good morning, everybody, and thank you, Jeff, for your leadership at Hartford HealthCare, but also with Governor Lamont in representing healthcare at our state level. It is my honor and privilege to share the body of work of hundreds of people who are working behind the scene in making laboratory hum and make testing available for our communities and our COVID patients. Especially want to thank the frontline workers, respiratory therapists, nurses, physicians, environmental services staff, phlebotomists, and all who show up with a badge of honor every day to work. Thank you for what you do. Jeff described 3 major points, and I want to walk everybody through those specific things. Number 1, the viral testing, which is the RNA-based testing that we perform, which is PCR testing. As of now, today, we do about 500 tests per day across Hartford HealthCare. We use 2 to 3 different platforms to perform these studies of these 500 tests a day. The patients come from our acute care hospitals of 7 locations and 5 drive-through locations that are distributed throughout the state of Connecticut. This viral testing, part of them is performed right here, developed by our scientists here at the hospital and within our healthcare system. The turnaround time for those, half of the 500, is 6 to 24 hours. The remainder of the tests are performed by our clinical partners that are national companies, Jackson Lab here in Farmington, Connecticut, LabCorp, and Quest Diagnostic take the remainder part of the testing. And among those tests, the turnaround time is between 24 to 48 hours. So that's step number 1. Number 2, the serologic testing, which are the antibody testing. These tests are up and coming. These are a very breakthrough. As the disease progresses, more antibodies are generated in the larger population. And among those, we're trying to find ways to test them. So there are 2 specific things that are happening in this body of work. Number 1, starting today, with Quest Diagnostic Partnership, we'll be rolling out 200 tests per day capacity throughout Hartford HealthCare for the state of Connecticut, prioritized by certain criteria so that healthcare workers can back to work, the first responders can respond quickly going back to work. Over the next 10 days, we'll be performing nearly 2,000 studies. And after that, it will be broadly available to the broader citizens of state of Connecticut. In, again, partnership with Quest Diagnostic, utilizing their centers and our centers together. The second part, that we have internally 2 different platforms that we are developing for antibody testing right here within Hartford HealthCare, and they are likely to go live mid-next week and 1 week thereafter. And again, those are dependent upon the supplies available. As you know, the supply chain has been tremendously under pressure throughout the country and across the globe. The third part, which is very important, that we want to make sure that we are there as a healthcare system when state needs to be back in an economic hum. When governor is ready to give us a signal, we want to be supportive through our healthcare system that we can test and put the workforce back into the work. This is the most responsible, measured, scientific way and a safest way to put Connecticut back to as normal as possible. And I couldn't be more proud under the leadership of Governor and our CEO, Jeff Flaks, to make this body of work happen. So those are the 3 specific things. One more thing that I think is important for us to note, that while we test individuals, treatments becomes essential for those critical individuals who are in our hospital, in our care. I'm happy to share that convalescent plasma is becoming that therapy under the research protocol of Mayo Clinic and Johns Hopkins. Our clinicians here at Hartford HealthCare and at Hartford Hospital developed, recruited, and obtained the convalescent plasma. One of the individual got plasma pheresis done yesterday at Rhode Island Blood Center. We're also working with the Connecticut Hospital Associations, other healthcare systems within the state, and American Red Cross right here in Farmington to develop our in-state program. And we will be the convener of that services so that every patient, every healthcare system has an opportunity to participate and obtain the plasma for the treatment purposes right here in Connecticut. So I couldn't be more proud of that. At this point, I'd like to invite our President and CEO back here at the podium. Jeff.
This morning, as Bimal just outlined, we had our first patient donate their plasma yesterday, which we're very grateful to, and we're excited that this will happen with greater frequency as time goes forward. What we wanted to do is I wanted to invite that patient to come forward with us today to speak to you and answer any questions. This individual's name is Chris Madison, and Chris Madison's very special to us for a variety of reasons. But Chris has recovered from COVID-19. Chris is a third-generation Hartford Hospital member of our family. His grandparents both worked here. They presently volunteer here and are very present on campus. His parents, his mother is a nurse, his father is the director of our transplantation program, and Chris works in our Center for Education, Simulation, Innovation, and is really a tech wizard. So when you think about the Madison family, and we talk about heroes in healthcare, people who serve on the front lines, people who've donated really the vast majority of their life to caring for others and taking care of others, and a life of service, the Madison family is a really outstanding example and so representative of the heroes today who are working in healthcare. Having Chris come forward as the first person to volunteer in this capacity and ultimately make this donation is really befitting. So I would like to have him available to you and ask Chris to speak to his experience, and he is comfortable answering questions as appropriate. So let me introduce again Chris Madison, member of our team here at Hartford HealthCare, and also a recent patient of ours.
Thanks. Good morning, everyone. My name is Chris Madison, and I'm a programmer in SESI. I started experiencing symptoms in early March. It presented pretty much like the flu, with fever, chills, cough, muscle fatigue. Luckily, it only lasted about 3 days before I started to feel better. But working in the hospital, I ended up getting tested, and unfortunately, those results came back positive. So I ended up quarantining for 2 weeks, which I then returned to work. I still am working mostly from home, just for since as a programmer I can do that. But last week I heard about the opportunity to donate plasma for recovered victims, which intrigued me because, as Jeff mentioned, most of my family works at the hospital. My mother is an ICU nurse, so she's on units with COVID patients. And most of the staff in SESI as well, my coworkers, have stepped up to do as much as they can to help. So many of them are staffing the drive-through testing centers or doing fit tests for the N95 mask. So I wanted to help in any way that I could. I started making some inquiries and found out that Hartford HealthCare was starting a program this past Monday for convalescent plasma donation, which coincidentally marks exactly 28 days since my symptoms subsided. And that's one of the criteria for donating plasma currently, is that either it's 28 days since your symptoms ended, or you have a negative test result 14 days after, so that they know you don't currently have the virus when you donate. So I ended up calling Hartford HealthCare, let them know I was interested. They called me right back. Everyone was great. I just had to answer a few brief screener questions, provide a copy of my positive test result, and then next thing I knew, I was scheduled for an appointment in Westerly, Rhode Island. So it was a little bit over an hour away from where I am in Vernon, but not too bad of a drive. I was initially a little bit worried about the Rhode Island checkpoint, but where the test center is situated, thankfully I didn't have to go through any of those, so it really was painless getting there. That morning, Bimal called me to show his support and thank me, which really meant a lot, and just showed how everyone really has been really supportive and kind of helping me through this process. Once I got to the testing center, the experience was really pretty easy. Just had to fill out a little bit of paperwork to confirm my eligibility. They did a brief physical just to make sure that I was healthy enough to donate. After that, I was hooked up to a plasmapheresis machine for about an hour. So they just insert an IV into your arm, which extracts the blood, takes plasma, which contains the antibodies, out of that blood, and then pumps the remainder of the blood back in so that you really aren't losing much blood volume. So thankfully, that means that unlike when you donate regular blood, I really didn't feel weak or lightheaded at all coming out of it. It really didn't have any negative impact on me at all. So overall, it was a really painless experience. I would definitely do it again in 4 weeks, which is the soonest I could do it again. And I would really recommend it to anyone who meets the criteria. Otherwise, I just want to say thank you to all of our staff and healthcare workers throughout the state who are on the front lines. They're really the heroes here. I'm just happy that I could help in any small way and really encourage any former victims to consider donating and call into the helpline and see what they can do.
Chris, thank you, and thank you for your courage and for putting yourself forward. I'm going to ask you, Chris, if you would, to hang here with us for a moment, and we would like to make you available for questions and to give more perspective to the extent there are questions. Before we do that, though, I want to ask Dr. Ajit Kumar, our Chief Clinical Officer, to come forward and provide the numbers we're experiencing at Hartford HealthCare and all our data today. Please.
Thank you, Jeff, and thank you, Chris. Good morning, everybody. As of today, we have 394 patients who are cared in our acute facilities across the system. We have 6 in Bacchus. Charlotte Hungerford has 22. Hartford Hospital has 182. Midstate Medical Center has 32. St. Vincent Medical Center has 111. Hospital Center Connecticut has 35. And Wyndham Hospital has 6. We're also caring for 57 patients in our community network. These are home care, and 3 patients in behavioral health network at this time. Yesterday, some of you had asked me about the recovery number, and I'm glad to report that we have 330 patients who have been left our hospitals across the state after some period of stay in the hospital setting at this time. And we have much more actually who left our emergency room as well. The other question has been asked about the testing, how much testing we're doing. We have done more than close to 7,000 testing at this time. We have about 23% conversion rate of patients actually who turned out positive. These are the numbers I'm presenting, the composite for the inpatient and outpatient setting. With that said, I'm going to open for any questions at this time.
Hi, Dr. Kumar. This is Emily Brindley from The Current. I had heard that the first Hartford HealthCare employee may have died after testing positive for COVID-19. Could you confirm that or tell us anything about that?
We do have one of our colleague, unfortunately, did not make it through this COVID crisis. And obviously our heart goes out to the family and friends and members of his team at this time, this unfortunate event. We're all saddened by this turn of event.
And could you tell me where that employee worked and what day he died?
Emily, as you can appreciate, the privacy around these issues are paramount interest to all of us. I would not be able to share more details on that.
Okay, thank you.
Good morning, Dr. Kumar. Bridget Ruthman from the Republican American. Could you tell us how soon that plasma drawn from Chris could be used on patients and how that will work?
Bimal, would you like to take this? Sure. Thank you.
Yeah, so the plasma would be returning back after processing of 24 hours at the blood center, and it will be back here in Connecticut in our possession later today or tomorrow. We have criteria outlined under the protocol, and that We are adopting the same, which is here at Hartford Hospital and Hartford HealthCare.
And one more question on that, thank you. The FDA seems to have weighed in on some rules that they're imposing on this. It sounds like you've mentioned them, but are these regulations that you're having to look into, or is this sort of a new space you're entering?
This is not a new space. Investigational research board and committees has been all adopted practice for a long period of time. The nuance you're referring to is that in a rapidly moving forward process, in a normal days, this would take years, if not months, and now we are working within certain weeks. So yes, we are obviously following all the guidance provided by the government and agencies.
Thank you.
This is Taylor Cello from Fox 61. So we've been talking about reaching a peak, and at one point we had said Easter Sunday was going to be the peak, but the numbers seem to still be going up according to the graphs that Governor Lamont has been showing every day. Have we hit the peak yet? How close are we to a peak? Do you guys have a prediction?
Yes, we've talked about it before, and our Hartford HealthCare and MIT collaboration and the model have been quite consistent, and we do not think that we have reached the peak yet. The peak will come sometime end of April or early May, and that's the time frame we're looking into, and it could be around between 4th and 5th of May, around that time here. We're still seeing increase in our numbers consistently, and the question is how pronounced the peak is going to be. That is to be determined at the moment. I think our rate of increase has been consistent across the Hartford HealthCare. And I think we're seeing a similar trend across the state of Connecticut as well. So we believe the peak will be, the peak is not here yet.
And if you want to remind them, they could also check it out with MIT at covidanalytics.io.
Yeah. Thank you. The website we have shared earlier on, covidanalytics.io, which was being developed by the MIT scientists and collaboration with Hartford HealthCare partners, provides a tremendous amount of information, gives you more tools for the clinicians, for public to use, looking at a variety of more metrics. And I would emphasize that everybody to keep an eye on this tool. We're developing a significant amount of predictive tools on that platform as well. So this is going to get more sophisticated as time go by.
And after the peak, do you know how much time we have after until we can maybe see the end of this?
That's very difficult to predict, as we talked about several different variables which comes into the play, such as social distancing. How well are we going to be respecting that piece? How the antibody testing changes the landscape of what we're doing? How contact tracing comes into the play in the mixture? How our nursing homes, or the most vulnerable population, the SNFs, manage this crisis at this time? There are several different variables which are still unknown. So difficult to predict how long the peak or the plateau is going to sustain. But if you continue to follow social distancing, the hand hygiene, the things we've been talking about, there is a possibility that we might actually see a decline, hopefully soon. And then after that, depending on a variety of different other factors, we can discuss about when the normal environment might return. But it's important to note, COVID is going to stay with our system, within our country, and within our communities for a long time, and we're going to see a resurgence later in fall. Don't know how big the peak is going to be, and that's why importance, the race to get the therapeutics and the vaccines becomes a lot more critical at this time.
If we're going to see a resurgence in the fall, do you suggest that we continue these social distancing measures until that resurgence is gone?
It's difficult to comment on that, only because we do not know where we are going to be with the therapeutics and vaccines over the next several weeks to months. And a lot of other factors are going to help us determine that part here. But one thing is for sure, I think our lives and our process, the way we work, will be different than what had been in past. So as things evolve, the science evolves, and we have a lot more understanding of different type of technology and tools we're putting together, I think we might be able to have a better sense of that in May or maybe early June.
Thank you.
This is Emily Brentley from The Current again. I have a question about Chris's plasma donation. So will his donation go specifically to patients who are at Hartford HealthCare, or does it go kind of into like the general bank that's been distributed to a number of hospitals?
At the first starting point, we want to make sure that all the controls are in place and the whole program and the process is appropriately managed. So for this time around, Chris's donation would be allocated to the patients here at Hartford. As just a reminder, we have 191 individuals who are COVID positive patients, and many of them, nearly 50 plus in our ICUs, and most of them are there for more than 10 days. So we have enough patient population right here. The value, and one more time, I like to really encourage, like Chris was suggesting, that it is not a very invasive process. If you could be the donor, please donate, sign it up. The process and the program here in the state with Red Cross is going to open up soon. And when that happens, we need donations and donors so that we can create this life-saving plasma for many patients across and not limited by it.
And if you want to remind them of the website, it's hartfordhealthcare.org/plasma donor.
hartfordhealthcare.org/plasma/donor. Please visit that website. We will share that. Thank you. Any other questions?
Yes, this is Sierra with the New Britain Herald.
Hello.
Will you guys have a limit on how many times a person can donate, or would they be able to donate as much as they possibly can?
I think just like any other blood donation, there is a frequency that's been determined, as well as the type of plasma, the strength of the dose that it delivers, so it's variable. But the short answer is that, yes, one person can donate multiple times within certain specific guidelines.
And one more question. Would I be able to get the number of PUIs in the system?
Yeah, Dr. Kumar would share that with you shortly.
We have 98 PUIs in our acute hospital setting and 27 in our community network and behavioral health setting.
Thank you.
Thank you. If there's no further comments, I'm going to invite Mr. Jeffrey Flaks again. Thank you.
Thank you very much, and Bimal, thank you for being here, and Chris, most importantly, thank you again for your courage and everything you and your family have done. Your family's an inspiration. The Madison family are really so emblematic of the people who provide health care in our communities today. What I wanted to ensure we spoke about today, importantly, is testing. And viral testing, antibody testing, how we structure our resources as the economy does recover, as Governor Lamont does advance other policies in place. We need to make certain that we're anticipating it, and we're doing everything possible now to be ready. So when policies change, when we need different types of approaches with more wide-scale testing, more capabilities to treat people differently, whether it's like the plasma donations, that we're ready and prepared in using all of our capabilities, all of our resources to help and support the community and do whatever we can under every circumstance to help advance Connecticut, keep people healthy, keep people safe, keep the people providing care safe. But this is going to be essential as we go forward, and now is the time to do as much as we can to be as ready as we can and as capable as we will be. Thank you.